but here we go. So just want to thank everybody for joining us today. Oh, there's 103, 104. So this is my first time moderating on a Zoom. So these are exciting times we're living in. So I'm really glad to be here. My name is Rhiannon Bennett. My pronouns are she, her, and hers. I'm a proud member of the Musqueam Indian Band, and I'm really honored to have been asked to come and moderate the panel today. So I'm coming to you live from the Tsawwassen First Nation lands. And all of you are likely situated somewhere on stolen and occupied lands. So just wanted to take a moment to acknowledge that and to acknowledge the privilege and power that I'm carrying today. So I'm carrying the power of being the timekeeper, and I have the privilege of being able to come to you live from my home, on my computer, on the internet. Drinking my water and having my coffee is a huge privilege that a lot of people unfortunately don't have. And I also want to forewarn people that I am home alone with a 4-year-old, so she may or may not pop in to say hello. And if she does, that's okay. And if she doesn't, that's okay. So, housekeeping, what to expect. So, today, we are here with the Battered Women's Support Services. You can follow along with us on Twitter at Ending Violence, on Facebook, and as well as Instagram. And if you do need support at any time through this panel, please make sure that you're taking care of yourself. If you need a break, stand up, stretch, have a drink of water, take a deep breath. And there's also team members available, and they can be reached at 604-687-1867 or at a toll-free number 1-855-687-1868, or you can also text if it's unsafe for you to make a phone call or just plain easier phone call to text. You are able to text at 604-652-1867. And we also have, I believe, our closed capturing going. And do we have our sign language interpretation? We weren't able to.
Unfortunately, no.
There was a lot of effort that was made to make that happen. So our apologies for those that are being affected by our lack of supports around that. And if you have some time to stick around at the end, we will be taking questions. And I'm also going to do my best to monitor the chat. You are more than welcome to ask questions live time as well. So I see there's already a question out there. No, I can't see you, but that's okay. As long as you can see and hear us, that's what's important. And a recording after the webinar. I believe that this is being recorded and will be provided when we're finished. So feel free to stick around for any questions. And like I said, my name is Rhiannon, and we will do our best to get your questions. So with us today, we have Summer Rain. Summer's pronouns are she and her. She is the Indigenous Women's Program Manager and legal advocate. We also have with us Rosa. And Rosa, I should have asked you for the correct pronunciation of the rest of your name, so my apologies for that. Pronouns she, her, and her, Manager of Direct Services and Clinical Practice. And we also have Angela, the Powerhouse Executive Director. So I'm now going to turn it over to Angela to give us a little bit of context about what we're doing today.
Thank you, Rhiannon, and thank you everyone for taking time to be here with us today. I am Angela Marie McDougall, and my pronouns are she, her, and hers. I'm really honored to be here with my beloved colleagues, Summer Rain Bentham and Rosie Elena Arteaga, and of course, the indomitable and incredible Rhiannon Bennett. And then behind the scenes, we have the amazing Rona Amiri and Justine Ramirez. I'm so grateful for their support. I am very excited to talk about the work that we've been doing right now at Battered Women's Support Services. And I'm going to share a screen here and just go through a few things. I hope that you can all see everything okay. Maybe the team member could just give me a thumbs up in the text that we got going on. And so today, we're talking about gender-based violence and COVID-19, and we really wanted to focus on the before, the during, and your role, which is to say our role in the reset. We want to talk about how we've been taking action, BWSS specifically, in these days. And I'm here on behalf of the badass team at Battered Women's Support Services. We are talking about COVID-19, and it is within the context of gender-based violence, and what it really is a pandemic in a pandemic. We already had a pandemic of violence, and the cradle from the grave experiences that follow us from infancy into childhood, as a teenager and as an adult, and then as an elder. And this lifetime spiral of gender violence is a useful way to help us see how endemic and how much of an epidemic gender-based violence is. You see here for everything around being a young adult, dating violence, and then as an adult, domestic violence and sexual violence, and then as an elder. And we can't talk about gender-based violence in Canada, and I'm here on the unceded and unsurrendered territories of the Musqueam, Tsleil-Waututh, and Squamish people. My people don't come from this land that we now call Canada. My ancestors come to Canada by way of Western Africa and Northern Sweden. And I was born here in these lands in the city that we call Vancouver. And Vancouver is the only home I've known. And I always want to talk about gender-based violence within the context of this matrix of domination. This isn't something that just appears in a relationship and between people out of nowhere. It is baked into the social fabric and the historical context, and within all of our relationships, within our communities, and then within the larger society. And it grows out of specifically these ideologies of colonialism and patriarchy and capitalism. And what's interesting right now is that there's a lot of analysis of how capitalism and patriarchy and colonization is being weaponized within COVID-19, and it's something that we've been paying very close attention to. I had the privilege last year at the request of Global Affairs Canada to go to China. I was in Hong Kong and in Guangzhou. This is an image of Guangzhou in mainland China. And what was the privilege was about meeting with activists, Chinese activists, who were organizing around Me Too. Of course, Me Too is still a factor. However, it's difficult for us to talk about it now. So I hope everyone remembers Me Too, as we've been in this little time of social isolation and navigating this pandemic. But Me Too was a pivotal time for many activists within China. And many Chinese activists actually were jailed for some up to almost 6 weeks because of their organizing around Me Too. So I had a chance to meet with a number of activists in Guangzhou, and who are also working in Beijing, and attend some events and talk about the work that we have here. And so those relationships carried over until present day. And it was the result of paying attention to what was happening in Beijing and Xinzhou and in Guangzhou that gives us a sense that they report a threefold increase in domestic violence while navigating COVID-19 and quarantine within those cities. And that was very instructive for us because just like China, Canada also has colonial and patriarchal and factors that contribute to the uptick to gender-based violence, but also just the reality that for many groups, the support systems for survivors were weakened as organizations were required to, quite frankly, shut their doors. And some haven't opened their doors again. It's been a journey for everybody to to figure out how to do remote work. And though home isolation, however vital to the fight against the pandemic of the virus, is giving still more power to the abusive partner within the pandemic of gender-based violence. And I want to point out that we've had a number of killings of women during COVID-19. Julie Rassett was killed by, Indigenous woman, was killed by her white male partner in Winnipeg, Manitoba on April 11th. And as reported by APTN, she was a mother, a sister, and a daughter, and a popular co-worker, and a member of Manitoba's Ebb and Flow First Nation. Tracy McKenzie, 35 years old, was killed by her partner in Hammonds Plain, Nova Scotia on April 2nd. And that's reported by Saltwire. And Audrey Hopkinson, a 33-year-old young mother and Brockville General Hospital nurse, was killed by her domestic partner April 1st in Brockville, Ontario. And the source there is the Recorder and Times, and rest in peace to women. And we know that every 2.5 days, a woman in Canada is killed by her male partner. And it is not lost on us that right now we're in the midst of unraveling what was one of Canada's largest mass killings, where a man who killed a number of people has allegedly killed his ex-wife, and that there is speculation that the violence started off as a domestic violence case. This has been reported in the Toronto Sun and then with some US papers, tabloids, though it has not been followed up on in terms of any sort of more trusted media sources in Canada yet. But of course, we're paying very, very close attention to that, because it is not lost on us that many of mass killings are, that start with the killing of a mother, a sister, a partner. So this is part of what we are referring to is the power and control. And this power and control view is power and control is the, I'm just hearing that you might not be able to hear. Is this better? I'm thinking this is probably better. The power and control wheel is a tool that we've been using since the 90s. It came from Duluth, Minnesota, the domestic abuse intervention program. And they created this incredible tool that gives us a sense of how power and control manifests within an abusive relationship, and that we can have an extraordinarily abusive relationship and nobody's been hit. This is very important for us when we also think about the role of power and control in the context of COVID-19, and that for everything that we see here, in terms of emotional abuse and intimidation and threats and coercion, economic abuse, male privilege and children, and minimizing, denying, and blaming, is impacted profoundly by the isolation that is already in effect, that is compounded as the result of the social distancing and social isolation that's been mandated by the public health authorities. And so we heard really clearly from our counterparts in China. And so in the beginning of 2020, in March, we moved as quick as we could to get out in front of this problem. We wanted to make it known that we were very aware that women were going to be compounded. And so we wanted to be sure that there were awareness around supports that are available and informing the community of these supports. And we launched our website first and foremost. That was a list of resources. Our homepage continues to be dedicated to factors around COVID-19, safety planning, lethality services, and we've been we haven't had this much attention to our website, and well over 100,000 people have visited it since we started, which is amazing for us. And this campaign around "Are you co-quarantined with your abusive partner? We can help" was our intention to share this provocative message and where resources were and how to access those resources to everywhere that we could. And so we use social media, which continues to be an excellent way to get the word out. And this campaign has been observed and has been connected with over 1 million people here in British Columbia and across Canada and other regions of the world. And we realized in doing the campaign that we were going to have to scale up our intake and crisis line. And we did that in one day. We went from our line that was open during the day, during the week, to 24 hours. And we did that in one day. It was an enormous undertaking, and it mattered a lot because calls increased progressively over the weeks, from 50% to 100% to 300%. And recently, one of our staff members received 18 calls on one shift. So we don't believe that domestic violence is increasing. Rather, we know that when we get the word out, we believe that domestic violence is being compounded, that it's already a pandemic that's been largely ignored for most people. And that by getting the word out, we had people reached out, and it's been good. The calls that we've been receiving vary in complexity, and there's 7 general themes, and each one is overlaid with COVID-19 content and implications. About 30% of the calls that we receive are women that are no longer living with an abusive partner. However, if you've experienced any kind of gender-based violence, and particularly if you've been under siege, power and control in a relationship for any time, that's trauma. And so survivors report having their traumatic responses activated by the current context of the social panic and stress around the virus. And then the isolation, so depression, anxiety, loneliness, and suicide ideation. About 30% of our calls are reflected there. And this is a quote from a caller. Women who are currently in abusive relationships or with a partner represent about 40% of the calls that we received. And so we are doing very specific and enhanced COVID-19 related safety and lethality assessments. We, as you do in a pandemic, you apply learning and you act quickly. And so we've been doing that. And about 40% of the calls that we receive are women that are currently with an abusive partner. And we're working through that. Here is a quote from a woman who talked about how her abusive partner was not maintaining the social distancing, and she was quite concerned about herself and her sons. And here is another quote from a woman who talked about that he's threatened to hurt her and kill her. And she's scared about what she would do if she was leaving. And she's also very scared about leaving because she doesn't want to catch the virus. And 19% of the calls are women who are currently accessing BWSS, who have a worker, and they want to continue their healing. So they're reaching out to their support worker, their legal advocate, their counselor, about 19%. And we have this quote from a woman who talked about how she wasn't sure, like she wants to leave, thinking about leaving, but wasn't sure if there was even places to rent right now. And this woman who found a way to really validate her decision to leave her abusive partner, because even though it's hard right now to live in such isolation with her 2 children, she can't imagine living under the context of COVID-19 with an abusive partner. About 3% of the calls that we've received are from family members of women who are currently in abusive relationships that are concerned. And so we will work through supporting the family member. It's a quote from a sister that was concerned about her sister. We receive about 2% of the calls are from neighbors who either know that their neighbor or someone in their vicinity has been or is currently in an abusive relationship, or they've heard things within recent times, and so they are looking for support. And this is a quote: "My neighbors are fighting. I can hear the woman is very scared and is screaming. What should I do?" And we're hearing from coworkers who are concerned about their colleague with the work from home time now. 80% of people that are in abusive relationships will report to their coworkers. And the workplace can be a place of refuge, but work from home is another matter. So here we have coworkers who now, given the change in work, scenario, they don't have the same access to their coworker and they're concerned and wondering what to do. And this is a quote. And we received a few calls from children and youth who are currently living with their abusive father. They've witnessed their mother's abuse for their entire lifetime, and they're concerned about their mother and themselves and their siblings. And so we've been supporting youth. And this is a quote from a young person who called us. The geographic regions, about 50% of the calls that we're receiving right now are from Metro Vancouver. 25% are from regions throughout British Columbia. 15% are in other regions within Canada. 5% in Ontario, and we received about 5% international calls, including women who are in abusive relationships with, in other countries in the world. They're Canadians, and they're wondering about how they can get back to Canada and also be safe. And what's really interesting here is that the UN commissioner made this incredible statement in a tweet about recognizing women under lockdown for COVID-19, and made an appeal for peace in homes around the world. So though he didn't name men directly, he said that he wanted peace in homes. And he also urged all governments to put women's safety first as they respond to the pandemic. And that was a vital call, we believe, from an international authority. And in early 2020, we sent a letter to the Premier of British Columbia to seek engagement on COVID-19 and gender-based violence. And we haven't heard back, unfortunately. And we have reached out to the Prime Minister a couple of times. But right now, specifically, to speak to victims, we really want to directly advise that supports are available. Because of the fear around COVID-19, it is a reason why abusive partners are using power and control, but it's also a reason why women aren't leaving. And we think that there is a responsibility, a public health responsibility and a social responsibility for the leaders of the country and the provinces and the health authorities to advise that supports are available, and that so we haven't heard back from anybody yet, but in the meantime, this is the team at Battered Women's Support Services. I get very teary when I see everybody there, and I know that some of you are on the webinar today, and I thank you for your work. This team has been extraordinary in being very dedicated and scaling up immediately, and we worked through a very short timeline and getting everybody working from home. We still maintain our office so that we can have drop-ins, and we are able to social distance there. And this is us. This is our crisis line. We're happy to receive calls. And this is us on Twitter and me on Twitter. And I'll hand it over to my beloved colleagues who will say a lot more about the work that they're doing on the front line. Thank you.
Thank you so much, Angela. That was great. That was very informative. Really appreciate you setting us off in a good way and putting that context into place about what the situation is that we're dealing with. So now I'm going to pass the mic over to Summer. So Summer, as I mentioned earlier, is the Indigenous Women's Program Manager and Legal Advocate, and all-round badass Indigenous woman who is doing some incredible work. So it's a real pleasure for me to introduce you all to Summer. And there you go.
Thanks, Rhiannon, and thank you, Angela. It's a hard presentation to follow, but I'll do my best. So I want to start with acknowledging that I am speaking and meeting with you all today from the unceded Coast Salish territories of the Squamish, Musqueam, and Tsleil-Waututh nations. And I have the honor and privilege and joy of getting to live, work, and play on my unceded territories. My name is Summer Rain. My traditional name is White Wolf Woman. I'm Gitsan from Kiwanga on my maternal side, and I am Coast Salish from the Squamish Nation on my paternal side. And like Rhiannon said, I am the manager of the Indigenous Women's Programming at Battered Women's Support Services. And I also have the exciting opportunity to participate in our legal advocacy program as a legal advocate. And so I am gonna talk a little bit about both areas that I come from today. And I wanna start with talking about the fact that, we are in a state of emergency. We are in a pandemic in relationship to COVID-19. But I wanna acknowledge that we're not in one state of crisis, and we don't have one pandemic. We've been facing a state of crisis on gender-based violence and violence against women and girls for my whole life, everybody else's lifespan on this webinar, and that I don't want that to get lost in the concept that we're in a new state of crisis, or that the crisis has increased for women and girls, and in particular for Indigenous women and girls, trans, two-spirit, and gender non-binary individuals. The state of crisis that we face on a day-to-day in regards to colonialism and racism and violence for who we are is how we live each day. Indigenous communities have been forced into isolation, have experienced pandemics, and we have risen up and we have rised up, and we're still here, and we're still fighting that battle of ongoing colonization and intergenerational trauma. And that can't be separated out from the current pandemic that we're in, or the current state of crisis. And what we've seen in the work in the last 6 weeks that has unfolded is that Indigenous women and girls, trans, gender non-binary, two-spirit, are in even more precarious situations, are at a greater state of isolation, especially in remote or rural areas. Our increase in call volume and requests from Indigenous women and girls that are in more rural communities, in particular in the north or in the Yukon, are at levels I haven't experienced before. And the lack of resources and the access to be able to leave an unsafe situation has gone from a challenging situation to a near impossible situation. We've been left in places where we've actually had to use RCMP to help get a young Indigenous woman out of a rural community in the Yukon, which I never want to be in a position where I have to rely on RCMP to help get a woman safe on reserve. And that's because the roads are shut down, the reserves are shut down, the one bus that runs through these rural communities is not operating due to the COVID-19. So the increased risk to our women and girls is at an astronomical level that is even higher than the one that we came into in this position, where we already are facing a crisis against Indigenous women and girls' lives being taken and going missing, and the state not responding, and the pressure being on the frontline organizations to be the ones to answer those calls, to do those searches, to connect with those families. So we've seen a heightened increase in this locally and rural in rural communities, and not just here in BC, but across Turtle Island. We've also definitely been presented with our fair share of challenges in regards to women who are unsafe, or women who have called the police and trying to get a police statement taken, or to have an accurate response from the police in regards to the violence that she has experienced in her home. So quite a few of the calls that I've taken on the crisis lines on the overnights are women who have already called the police, and the police attended and said that they're not arresting, but that, he can stay in the garage, or he can stay in the living room, or he can take a walk and come back due to the pandemic. And in other cases, we are having struggles just getting an in-person statement with police. Police are wanting to do statements over the telephone. Detectives are working from home. And for women who are in unsafe situations or precarious housing, being able to provide a police statement over the phone is not is not necessarily in her interest, especially if he's in the next room. So we've had to do quite a bit of advocacy to actually have the police be able to respond and take those statements. And we are still on the front lines, and we are meeting with women in person, and we are advocating for those statements to be taken, so that she is getting the response that she is entitled to from the police at this time. Similarly, we've come across the same concerns with the child welfare system when, you know, with the heightened increase in violence in the homes, there's a higher level of MCFD involvement, or women who are concerned about their children's safety when they're with the other parent, and neighbors or bosses reporting to MCFD concerns around child welfare. So women are getting contacted by the ministry and having to provide interviews to social workers, which would normally happen in a safe, secure location. And those interviews are happening over telephone or over Zoom in women's living room with children, with potentially the abuser 2 feet away, with no guarantee that her and her children are going to be in a safe place after providing that information. So it has definitely presented us with new challenges that we don't normally see within the child welfare system. And it's more challenging to be in that place with her, to provide her that support and to run interference to the degree that she's entitled to have. So we're still up against those same challenges, and will continue to be over the next however long we're in social isolation. And we will continue to meet with women and continue to provide a safe place for her to be able to give those statements or interviews with the child welfare system or with the police. We've definitely had an increase in calls in regards to legal information or legal resources from women, and wanting to know how they could possibly be able to access the family law system or the criminal justice system in regards to their current files or new files that are needing to move forward. And we've definitely seen an increase in abusive men using the fact that the family law system is on a limited restriction of what they're hearing to find new ways to withhold parenting time, or to interfere with parenting time, or provide parenting time in unsuitable circumstances when he may be the primary parent. So we have women who are expected to do their access in garages or at a playground that a child can't play on, potentially exposing the child to the COVID. So our legal advocacy team is hard at work doing multiple applications for urgent family law matters, drafting affidavits, and working with legal aid to get women approved, or connecting them with family law lawyers, which is also challenging because many are stepping back in the work that they're doing. So our legal team has definitely taken on more drafting of documents and more legal arguments for women, and just being the most up to date on what rulings are being made, mostly out of Ontario and some in BC in regards to withholding parenting time. But women are calling with being concerned that they're going to be accused of kidnapping or being accused of withholding. In particular, if they might be in a shelter or a transition house in which the housing is saying that you know, if they were to leave, they would be put into isolation for 14 days, or they would potentially have their housing at risk. So, which is not the case in most situations, but it are definitely the arguments that are being presented. We're also seeing an increase in the criminal justice system, which is built predominantly by white men for white men, still protecting and still being there for predominantly middle-class white men. And so we are seeing applications being accepted that don't deem the urgent family matter basis for women, and women being left in a position where there's now an interim order that has come into place with no real way to be able to challenge that back. So it's definitely Myra and I are definitely have our hands full, along with our short-term support workers, and being able to learn quickly and navigate the new system that we are in. We have also seen an increase on the crisis lines for women who are currently in an unsafe situation or an abusive relationship, and with concerns about accessibility to transition houses or shelters. And so as a team, we were able to come up, strategize, solve solutions, and get our own access to independent housing for women during this time, to be able to go either by themselves or with their children, which is an amazing feat for a small organization like ours, which is, who doesn't have a transition house and wouldn't normally be able to offer that service, and we would need to rely on the existing services that there are. But being able to have that with the increased volume of calls has definitely made an impact for the women that we're supporting. And moving forward, what I see as an outcome, or as a result of this pandemic, is that, the world across Turtle Island, violence against women, trans, two-spirit, non-binary, is at the forefront of people's conversations, is at the forefront of the local media. It's all over Facebook, and this is how it needs to be all the time. This is not new. This is not going to go away after COVID-19 goes away. Women are at risk and unsafe in their own homes. Women are at risk and unsafe at work. Women are at risk and unsafe on the road. This is nothing new to us as frontline anti-violence workers and organizations, but the support and the recognition that has come out in a way that hasn't been there. Society feels an obligation in this moment to do something about, their neighbor who they knew was unsafe a month ago, but this month they want to do something about it, or they feel an obligation to do about it. That's what I want to see every single day. We as frontline workers, we can do our work from anywhere, and we've shown that. We've done that. We've quadrupled our capacity. But what I want to see is, I want to see the Canadian state moving forward to keep gender-based violence at the forefront of every conversation, and to see it represented in the media that it is, in the way that it is right now. And what I encourage and what I want is us as frontline workers and as a society to not move forward without our most vulnerable. So our Indigenous women and girls, our trans, our two-spirit, our gender binary, our fellow members who are currently in the sex economies and working in survival mode to get through this pandemic. Like, we can't leave those women and girls behind. And the risk to their safety is at a higher state than it has ever been in any moment of our time. And so we have the ability to continue to do this work, and we have the ability to be the leaders in this moment, and to be the warriors that our community needs. And that's what I see us doing moving forward through this pandemic, and what I see each of you who have joined us, all 144 of you, doing is each of you have the ability to keep violence against women and girls at the forefront of this pandemic. Haishka, Lucian.
Thank you very much, Summer. That was some really powerful information that you shared. That we are not just in one state of crisis is really important to remember. And we are all warriors on this, and we are going to keep it up. So I'm going to pass it over now to Rosa, Manager of Direct Services and clinical practices for the battered women support services.
Thank you. Yes, amazing team. I love my team and I feel so proud to be part of this conversation. I am a settler in this unceded land and I am an immigrant woman from Mexico. I have been living in Canada for over 23 years and I have been working with BWSS for over 16 years, maybe more, but yeah, too long. And I really love our organization because just to think, as Angela said, that we knew that the population we work with experience many forms of violence and that through COVID-19 and having to quarantine, whether by themselves, with their children or with a partner who is abusive, we knew that many struggles they are going to face and we had to prepare really fast. To prepare really fast without having the proper equipment. I'm still learning how to use Zoom and without having all the cell phones that we needed, laptops. So the first week, it felt like a year of our lives because we were working 24/7 running and we never stopped providing the support and answering the intake and crisis lines. And I want to share a power and control wheel that I created. So hold on a sec, as I said, because I'm trying to figure out how to use this. It's here. This power and control wheel, I created it to reflect all the barriers and struggles that immigrant, refugee women who don't have a status face, but I think applies to the majority of the women who access our services. And what we know is that the violence against women is endemic and is epidemic. And the problems that we have seen are always the same. The struggles are always the same, just that through COVID-19, these problems get amplified. You know, all the disparities and the injustice gets amplified. So we have the structural oppression that girls and women and LGBTQ communities face. And we have always developed ways to support these populations through having the legal advocacy program, through doing crisis intervention, providing counseling, over 10 support groups, providing a program for women who are seeking to join the workforce. So every single time that we notice that women are struggling and that there is a specific issue, we are going to respond not only on individual basis, because we know that the problem is not the person, the problem is not the woman who is rather to what the society think when they think that about why she doesn't leave. It's not that she can just open the door and leave an abusive relationship. The majority of times she has to escape. And in order to escape, she has to have many supports. It's not just about short-term support and to provide basic needs. Sometimes it's about counseling because, as Angela showed, the spiral of gender-based violence, many of the women who access our services are dealing with long-lasting impacts of childhood trauma or the impacts of being in long-term abusive relationships. Also are having to deal with the legal system. So at each step, we have created programs. But then COVID-19 came, and all of a sudden, all the knowledge we had to put it in practice by working long distance. And through having to access resources that had changed completely. For example, for the family law system, the court closed, they made changes. So now our legal advocates have to navigate a system system that it looks different. However, because we are very creative and we are hard workers, we always find a way to address all those barriers. So what I want to share is that through our crisis line, we have been supporting women with immediate needs, whether it's just emotional support, safety assessment, safety planning. Of course, because of COVID-19, it has been triggered the impact of trauma, or also this feeling of feeling trapped in the relationship. So many women call who have suicidal ideation, and we work with her towards making an assessment and safety planning, towards referring her to other workers within BWSS who can provide ongoing counseling. Other women who have issues with substances, that issue has increased as a way of coping with what they are going through. So we have been able to create also safety plans with them, and including in some cases finding access to recovery housing. Also for counseling, we already had over 300 women on our wait list. We have over 6 counselors providing counseling, and we had to add more hours just to ensure that women had a contact person that they could continue their healing work. Because as you know, according to research, it takes 7 times for women to leave an abusive relationship, go back, leave again. And what I know through our work at Battered Women Support Services, during these 16 years I have been working there, I have been keeping track of how many times women go back and forward. And based in my data, it doesn't take more than 2 times. And the reason for that is because we have a complex system that address all the different areas and the different needs that women have, right? From the emotional to physical support, through economics, through legal support. So all of that we provide through these programs. Also, we provide training to women in the community who want to join the crisis line and support women through the support groups or through the crisis line. And at this time, because of COVID-19, we had to make decisions around, should we provide the training, how we're going to do it. Usually we do it at our office. But then we had over 23 women who had been accepted for this training, calling us every day, sending emails saying, please don't cancel the training, find a way to provide the training. We want to support people in our community. And then we decided to provide the training through Zoom. So last week we had 23 women who joined our presentation, who were there on time, and they were so eager and excited, even though we are going through hard times. We have many stories of women who are single moms, who they find sometimes hard to go and buy groceries. And we have been finding supports for them to receive food at home. We also realize that many of the women who access our services, who live in poverty, they hardly can pay for their cellular phone, and to have more minutes to communicate with a worker. So we were able to get phone cards, so then they can call us and connect with us. We know that we are supposed to keep the social distance, right? But our service is essential. So many times we have to do accompaniments. Like I know Summer, as a legal advocate, she has done accompaniments with women who are dealing with child protection, with child apprehension. Also, I know our legal advocate, Myra, who is an amazing legal advocate, and she has been working so hard nonstop. She has been receiving many calls from women who don't call the crisis line. They call her phone directly, because now other women are giving the phone numbers of the workers. And workers are, so if we calculate the number of calls that we get, not only through the crisis crisis line, but through our whole team that is around 20 people, is many calls that we get every day. And what Myra shared with me is that she sees a trend about women calling because they want to leave an abusive relationship, an abusive partner. So in that sense, they do a lot of safety planning, and they are planning towards the future. So before, we used to have people, women coming to our office who were in this process of already making the decision of leaving or have left, and they wanted to have information about custody and access or child support. Now women are planning ahead of time. And what they are saying is, when this is over, and when I'm able to get more resources and access to housing and the things I need, I definitely am going to leave this abusive relationship. So we have been in the struggle, trying to figure out how to navigate these structures and these systems that are there to support people who are oppressed, but that a lot of the times end oppressing people further. So we have always learned to navigate. We continue learning how to navigate. We will continue doing this work. And also, we are going to start providing support groups, because we had to create our system about confidentiality and what is going to be the structure for people to join that support group. So next week, we are going to start the first one, because women are also asking that. They miss the connection, and as you saw on the power and control wheel, isolation is one of the main factors that contribute to violence against women in intimate relationships. So I'm so happy to be part of this team. And also I'm happy to have colleagues who are working in other organizations. And last week we organized a victim service networking meeting, and we had a number of people from the domestic violence unit, from a Broadway Youth Resource Center, Kiwasa, many others, multicultural family services, who joined the conversation, and we were all working towards sharing resources, acknowledging the trends, talking about how we are going to continue providing the support within our different areas of expertise. So yeah, I have a lot of hope for what we have done for the future. The women that I helped through counseling, they have told me, I cannot imagine going through this time without having a counselor connecting with me. And it's because of having this hour and having this opportunity to connect with another person who is supporting me through this hard time that I'm going to get through. And when many women say, when this is over, I have this dream. And when this is over, I want to do this for the future. So in the reset, we are all together working towards the future. And I'm not going to give up to finally one day, and I always say, in this life or the other life, to end violence against girls and women and LGBTQ communities. Thank you.
I was just trying to give you a 2-minute wrap-up warning. Then you were done. Thank you very much. That was very informative. I really appreciated all of your information about the work that you're doing. My heart is so lifted knowing that there's 23 women that made it a priority to come online and receive that critical training. That's just amazing. Now, there were some questions that were popping up in the Q&A, and I see that Angela has grabbed some of them that she is going to answer. Did you want to answer them now?
Sure, I could do that. Maybe I could ask Rosie Elena. We had a question just about the languages, and I know that we've been discussing the languages right now as we're going 24. Would you be willing to comment, Rosie Elena, about how we're managing languages outside of English?
Yeah, so within our staff members, we have a number of languages, around 4 different languages: Spanish, Portuguese, Polish, and French. And but also among our volunteers, So we have the current volunteers who are not answering the crisis line at this time, but they made themselves available to provide translation, and we have around 17 languages that we can connect with them if we need translation.
Mm-hmm. And I think we're also right now in the process of wanting to interface a little bit with BC 211 that has some languages, but I think that there's still we're still sorting that out. I understand.
Yeah. Also, multicultural family services. Uma was at the meeting last week, and she sent a list of languages that they have available, and she has offered that if we need to connect with them or do a referral because the person prefers to speak in her primary language, that they are happy also to be available for support.
Thank you, Rosa. There was also a question in the chat. Not sure if it was directed to either Rosa or Summer directly, but there's a question about insights on the particular challenge of Two-Spirit LGBTQ plus women and non-binary folks are experiencing and how we can meet their needs. Each one of you want to take a quick answer on that?
Yeah, so what experiences I've had with the LGBTQ2 plus S community in particular who have been calling is mostly are in currently unsafe situations and looking for housing, and housing that's going to be supportive, that's going to be accepting, that's going to be safe. That's the primary request that I've seen coming up on the lines, and then also requests for ongoing counseling, in which we have the ability to offer both by the fact that we have private rooms to be able to offer, as well as ongoing counseling. So mostly those would be the two requests that I've seen coming up on the lines in the last 6 weeks. At a heightened increase. I don't know about Angela or Rosa, who's also been answering, but that is what I have seen.
Thank you. There's a few other questions here, but I think I'll leave them for the Q&A because some of them might be covered when we have our talk about all of our roles in the reset. So if everyone wanted to unmute themselves. So Rosa, I think you just got to unmute yourself. And if we just have just a nice conversation about what our roles are as we reset, because I am like you, we are going to be the warriors and we can't go backwards. So here we are today, and how are we going forward, because we can't go back to what we had.
I think Summer said it best. I would love for Summer to continue on that vein, recognizing the current situation and how much the community is mobilizing, or at least the awareness raising that's been happening.
Yeah, so the following what Summer and Angela said, I'm always so, how can I say, it's amazing the number of people who have called BWSS asking, do you need help? Can we help in this way? Can we do this? Can we, like everything, right? Even finding some rooms in a hotel when we needed to find some immediate housing for people who were calling. So I'm really impressed with the level of how many people within society are calling us and are aware of gender-based violence issues, and that they want to contribute to make a change. So I just want to invite more people to join this team, this global team, that we care, because globally many people are exposing how and becoming aware about the level of violence that girls, women, and the LGBTQ community are facing at this time. So I think that it would be good if more people join and collaborate, and to understand that this is not an individual problem, that this is a societal problem, and that we as society living in this world, that we have been doing harm even to our own land, the land that we live in, this planet, right? We are doing harm to the planet. So I think that we need to work together towards making that change. And I hope that with the time that some people have had to reflect during COVID-19, they can contribute in any way, whether it's financially, whether it's speaking up, joining organizations, supporting the neighbor who is experiencing violence and abuse.
For me, in regards to gender-based violence, violence against women, intimate partner violence, sexualized violence, we don't have to go back to the way things were pre-COVID-19. We are in a moment to reset and a moment of resistance. We don't have to go back to the triangle that Angela talked to us about patriarchy, capitalism, colonialism. We have the opportunity to define what it looks like moving forward for women and girls, for Indigenous women and girls, for women of color, for trans, gender, non-binary, two-spirit. Moving forward, this is our moment to determine, to direct, to guide society how we want to talk about violence against women, what our expectations are in these moments moving forward. Right now is a moment to look at the fact that many of our organizations have seen an increase in requests, in access to services. We have a 300% increase. That's not 300% more women. That's only that's what the call should be like every day if we're talking about violence against women, because we know the statistics. Like Angela said, a woman is killed every 2.5 days. We know the rates of sexualized violence is like 1 in 4. Physical violence is 1 in 3. For girls, it's 1 in 7. So the fact that we're seeing an increase in calls right now doesn't mean that there's an increase in violence. It just means that there's more people reaching out in this moment. And I want to keep that level. I want to continue to see a 300% increase, because it means that we're finally, as a society, talking about what's happening behind closed doors to our women and to our girls. And I think that I want to stay in the state where we continue to shift the language around violence against women. I want it to become a part of everybody's dinner table conversation. I want to keep Indigenous women and girls at the forefront, and I want to know when something is happening to the women and girls in our communities, and I want to know that their neighbor, their chief, their council, their boss, they care and they're stepping up and they're doing something, because and connecting people to women and girls to our services. So I want to see an increase in resources, but I mean, otherwise we don't need to go back. We're in an opportunity to shift how society is responding.
So, you know, what I've really noticed is that as the world has sort of slowed down, it's like the veil, the carpet, whatever you want to call the covering, has been lifted. And all the things that we have been talking about for years, that your organization has been championing for years, about all of these things in our society that aren't serving us well, how capitalism is killing us all, and those power dynamics, and just the nature of the way that capitalism needs to survive and function is that people are busy, people are caught up in their own world, people are caught up in their own homes. And now that the world has slowed down, there's a lot of people picking their head up and seeing things really for the first time. So my question for the three of you is, now that the world has sort of slowed down and people are starting to wake up and pay attention a bit more to things that we have always known aren't serving us well, what would you suggest to those people as to where to start, where to take their first step, because there's people out there that are going, I had no idea, or this is new. And we want to be bringing those people along, right? We don't want them to stay awake. We don't want them to get caught back up in their busyness when whatever it looks like going forward. So what would you say to someone who is just really starting to pay attention to all these things that are happening around them?
Yeah, it's a really interesting time, and you know, of course, it's dire and unprecedented, and you know, and it's an uncharted moment we're figuring out as we go, and imagining the reset is about a vision, and it's about having a vision for a world that applies knowledge from the past, that wants to change the way we are. So I think what's been quite remarkable is that we've seen governments take action with, you know, for some portion of the population in supporting the financial needs of people while during the shutdown, which has been interesting and obviously vital for many. Though I know there's many that have been left out of that, those that were already struggling in on income assistance or a disability, who have been left out of that, and we certainly want to see that redressed. And I think that the goals around how we look at our economy, how what we want from our economic structures, these are all incredibly important factors in the social fabric. And so I do hope that we can advance progressive ideas using platforms such as this one today, to be able to have these conversations, and to be able to engage as many people as possible through the various, through media, through social media. And so it's my hope that those that are here, and the friends and family and colleagues of those that are here, that we can, as a group, advance these ideas and continue to move in a direction that is about a change, that is about a more equitable society, that is that's just and in right relations with the land, that is redressing historical imbalances and struggles. And it is not lost to me at all right now, in a sense, that particularly around gender violence and the crisis around it, that the governments have largely been they haven't been very prompt with their response. I mean, the provincial governments all across the land have been invisible in this, in a sense, the municipal governments as well. And then the federal government, I know, made some important investments in supporting shelters and in supporting rape crisis centers and sexual assault programs, which is vital. But there's 600 plus groups that are doing work such as us that fall between those cracks, and that work is vital. And so I think there's unfortunately, we're still trying to get the government to understand how endemic and how much of an epidemic gender violence is, and the importance and the necessity to prioritize that. We are not there yet at all. What is remarkable right now is that, and this is sort of odd and certainly flies contrary to what my what my maternal family would, as socialists, would want to see, but that's around the private sector and individuals who have stepped up in incredible ways. We couldn't have done this work without the support of the private sector, individuals and businesses that have made it possible for us to go 24 hours. We did it. And so that's been really interesting. And so I think that there is a critical mass, in a sense, right now. And so what people can do is to continue to engage in those conversations. And it's our intention to share those resources and to continue to further this conversation in all the ways that we can with our small, in our small little, organization here in Vancouver. But it matters. It matters right now more than anything. This was one of the most pressing social issues of our time before COVID-19, and is most definitely the most pressing social issue of our time during COVID-19. Right now, we've had at least 3 women that have been killed by their male partner or ex right now in the last month. And of course, one of those was also a part of a mass killing. So the lethality here cannot be denied. However, we're still trying to make it visible in some sense in terms of the government, but not certainly with the people. So onward.
Thank you. Summer, did you want to add anything to that? No, Rosa?
Angela,
No, that's
Okay. I'm going to go through some of the Q&A questions. Really appreciate everybody's comments on that. Like it is really important that we just keep talking about it. Okay, so from the Q&A. Are there still volunteer opportunities happening right now?
Maybe I can just start, Rosaletta, and then if you want to jump in. When we moved so quickly to 24 hours, 24/7, and then the social distancing happened. We stepped off our volunteer program, which has been responsible for answering our crisis line, because the calls were more complex and it was harder for us to supervise those calls working remotely. And so we made a decision just around the learning curve and in the interest of the ability to have our most experienced workers on the lines. So we weren't using volunteers. We haven't used volunteers to answer the crisis calls right now. We're in the process of right now phasing volunteers back into our work. So we're, as Rosaletta mentioned, we're training 23 women currently and making a plan for how to have the other large number of volunteers that we have, upward of 40, begin to take calls. But the remote access is something that we need to figure out. So it's a bit of we've got a little bit of work there, but we expect to have a volunteer. We do our work. Our work has been historically done by volunteers, I mean, for decades. And it's amazing the amount of incredible people that have volunteered their time and done life-saving, vital work in the interest of equity and justice and liberation. And so we're going to continue that, but we have to figure out some things between now and then, but we will. What did I miss, Rosa?
Yeah, so yeah, we are going to continue training volunteers and finding a way for them to participate. And the interesting thing is that throughout our training, we have included COVID-19 as part of every aspect of the training. So if we talk about the power and control wheel, how that power and control wheel looks now, and what are the behaviors and tactics that the abusive person is using to maintain power and control over, in this case, a girl, a woman, a member of the LGBT community. So how this power and control wheel looks very different depending the social location of the person who is being victimized by a perpetrator. So that's part of the topic, and we are going to include that in the legal issue. So whether we go back to gradual entry into the workforce again as it was before, or we have to stay longer in kind of this structure of having to have social distance, and we are going to train our volunteers to respond to the needs of the people who access our services, whether with COVID-19 or without COVID-19. So if someone who is attending this panel wants to join our training, feel free to send an email to intake@bwss.org. And you can send an email just asking questions about the training opportunities, just to register for the next training. We are going to reply right away because we value a lot the eagerness and the willingness that many people have to volunteer with us in different forms, right? So yeah, thank you for that question.
Thank you. So next, there's a very specific question about housing and rental assistance. I'm not sure if we want to handle that now, if we want to answer that offline. Do you want to come back to that one offline?
I think so.
Okay. Next is, you've highlighted that there's an outpouring of women who are paying attention to women abusive relationships as a result of COVID. What resources and donations are needed right now?
Mm-hmm. So I think that anybody that is, in any region of any region, Turtle Island or around the world that's listening right now and watching, to support your local frontline women's organization, your frontline anti-violence organization, Transition House, with a gift. I know that for us, we've benefited from the individual donations from people. And we had a public service announcement that had a direct ask for our expenses have increased, to another $25,000 a month to do 24 hours. And so, and we've had to close our thrift stores, which were my sister's closet, which were main sources of revenue for us in terms of discretionary revenue. So I think give to your local women's organization, anti-violence organization. And if you're, you want to support the work of Battered Women Support Services, please check out our website, BWSS.org. And what we're using the money for is for our crisis line. We're also using it for transportation for women in order to get to and from different places that they need to get to, including safe housing. We're in the process of translating a bunch of different resources around COVID-19 and violence, and in a number of languages. As well, we continue to need to access cell phones, not only for our team, but also for women that don't have phones, as well as minutes. As Rosa mentioned earlier, the need for minutes so that women have the ability to be able to keep their phones active. And so those are some of the costs that we have right now that we are unfunded, and we could benefit from those donations.
So send money.
It helps.
Always send money.
That helps.
Now there's always the very important question of, with a 300% increase in your service delivery combined with our current overall social situation with the pandemic restrictions, can you talk about how you're taking care of yourselves so that you can continue to do this good work? Because that self-care is so important as we're carrying heavy loads at work and at home. So maybe you just wanted just a quick one of your special self-care things that you make sure that you get to every day.
I can talk about the group and then the individual. So about the group, with our co-workers, we have meetings every day, whether it's in the morning or afternoon, just to debrief what happened during the day, what were the kind of calls we got, how we are doing, what kind of resources are needed, and just to see each other, because we miss each other. And I notice the difference every time that we connect through Zoom. Everybody gets so happy to see each other, right? And actually that's what we hear. Oh, I miss you guys, and I miss to be at the office. So that's very helpful because we meet every day. And then for myself, what I can say is that some days I do yoga, other days just go to sleep at 8 p.m., 9 a.m. I just pass out. I'm so tired, so I just go to sleep. I have conversations with my friends, and I go for walks. And that's what I do as individual. But I think that is also very important to acknowledge that a lot of us miss that connection with our colleagues, because at our office, we debrief all the time, right? And as a manager of direct services, I get people coming into my office by the minute, all the time. So now a lot of us are doing work in isolation, and it's hard to connect right away. So it's very helpful to provide our team with the space for them to debrief the hard calls they have.
Thank you. Summer, did you want to share?
Oh, well, I'm weird. So my my self-care is, I love the crisis line. So if anybody knows me, it's a break from what I normally have to do, being responsible for people and things. And the crisis lines are like my downtime, which I love them. I also have adorable puppies that keep me entertained. And I've basically renovated my whole entire house. I am not good at sitting still. And other times I like to do more traditional stuff. My drum and I and the dogs have been like out in the nature just to get reconnected to land and ground. And there's 100 half-started art projects in piles around me that, eventually I'll get done.
but like, you know, finding things that are bring joy into my world. So for me, the lines actually bring joy. So that's my biggest relief. I would not be a happy camper if I just had to sit in my house without like concrete actions to do. I can't.
Thanks. Angela?
Yeah, I'll be quick. I agree. I echo what has been said so far. I enjoy the struggle. I get a lot of energy from the struggle. My work has taken me off direct service. However, I was doing crisis work on answering a crisis line for a period of time when we got started, and it was important. This is I live to end oppression. So to be able to take action right now is something that's very important to me. So I get a lot of energy from that. And then in terms of being tired or all of the things that come from a lot of work, I feel the extraordinary amount of privilege to be able to work with a strong team that's really smart and that works hard and is so committed. And so at the end of the day, it's just a privilege to get up every day and to be in this struggle and to know that we are making a difference and to know that we're helping shape a path for the future of this work. And then one thing that I did do, just like Summer Rain and Rosie Elena, I have companion animals, which have been great joy. But one of the things I did do is that I created a little outside spot for me and outside my apartment. So I've been sitting outside with some lavender, and it's been quite lovely to be able to do phone calls and to check in through there. But it's like, as you started, Rhiannon, it's just an extraordinary privilege to be able to have work that is fulfilling and is that matters, because I know that a lot of people are struggling with the inactivity and a disconnection. And so this is a privilege.
Yes. Thank you very much. I'm glad that you are all have things in place to take care of yourselves through these challenging times. Finding the joy is, my 4-year-old has found the joy in the rain. Just a minute. And is eager to get out and stand in the rain, which probably is good for many of us because water is life, water is healing. We go and stand in the rain for a moment. There are, some more questions. Some questions about housing. Someone asked, Rain was mentioning about housing. Where are women able to go now since the demand has increased so acutely? So if someone wanted just to have and there's some other questions about housing. So if someone wanted just to talk about some of the solutions that have come up recently to address the housing and shelters.
I could do that if that's okay, just to talk about that. Yeah, so we have a vast network of transition houses all across British Columbia and across Canada. And that is our first point. We want to keep that connection really strong. This is the transition house movement is a strong and vital movement that we want to sustain, and so we will reach out to transition houses first as far as crisis housing, and I just want to give a big shout out to our colleagues that are working in transition houses all across the land, and thank you for your work and your advocacy and for doing everything you can right now in a communal environment. It matters a lot, and I know the challenges that you've been having. And so what we've also then, as I believe Rosie Elena and Summer Rain mentioned, is that we had a hotel owner contact us, and we reached out to them, and they agreed that so we have a floor in a hotel that is great, that we have that ability. It's a lovely hotel in Vancouver. We have that ability for women that we're unable to house through the traditional transition house network. And then some of our colleagues also have apartments or hotels. And so we've been really fortunate about the ability of how groups have been really creative and painting outside the lines. And so we've got that. And what we've noticed is that for a lot of women, they're just happy to know that there are options. In addition to transition houses, they're happy to know that there are options And so that's something that we've been really glad about, is to be able to ensure that we're part of a vital network of resources that is connecting and doing everything we can right now.
Great, thank you. Okay, some questions that have come in. With the courts closed, many of us are experiencing a terrifying increase in battery. Many abusers are escalating without courts to oversee. How do women access justice when justice is not even on? How do we safeguard women and their children for the next pandemic and court shutdown? So some solutions that are happening now, and what are we planning for should a similar situation arise again in the future?
Summer, you want to share about that?
Well, so I think it's important to note that the courts aren't, like, the justice system is not completely shut down. It is still operating on an urgent basis, in particular for restraining orders, protection orders, no contact orders. So there are ways to maneuver through the system with its limited capacity in what it is offering. And so we are still definitely walking women through that process in order to get those orders, and have had success in that to date during the COVID, as well as some of our counterparts in other areas have also reported back some successes with that process. And then otherwise, you know, it's unique and creative safety planning. It's looking at other options or other outcomes in order to help women secure safety in the moment. What is needed is a different level of intensified advocacy to get those results, though. And so it is taking longer to get the basic results for women, but it is still possible to get those results. I forgot the question.
No, that was good. And what are some lessons learned to put things in place to make sure that should things end up like this again, like what are some key takeaways about how we can make sure that we are prepared for something like this to happen again in the future?
And I want to add, if we think about the criminal justice system, has been an ongoing work before my time, like, you know, always trying to make that system accountable to respond to the women who are experiencing gender-based violence. And a lot of the times women have to prove that they are victims, right? And it's a lot of work for them to prove that they are the right victim to be supported. So now through COVID, what we have noticed is that it's harder for them to make the phone call. And once that they make the phone call, police are, at least patrol police, are having these protocols and creating more barriers for the women to access the criminal justice system. And the good thing is that even if it's needed that we go into our office, and of course we create a system where we keep the physical distance, we are willing to meet with the woman at our office, for the police to come there and to take her statement if that's needed. But they should find a way to respond to those phone calls right away, because as we know, that for women to access the criminal justice system is the last resort. A lot of women have been oppressed by this system that is supposed to support them. So, and also many women don't want to harm in the way of sending their partner to jail. They don't want to do that. They want the violence to stop. So it's very hard for them to make the decision. So once that they make the phone call, I believe that the police should take that serious and provide any kind of resource for her to go forward with her statement.
Thank you. Anyone else have anything to add to that one? Nope. Okay. So there's a lot of questions. There are good people on the call with us who really want to find ways that they can help support your work. So we've already covered that financial contributions are very welcomed and needed. There's also been some asks about some volunteer outside of crisis lines. So is there any other way that people can support their time? Whether the cool new thing to do is make masks, if you're like, what kind of things can people do to help deliver groceries to families in need? Yes, there's a lot of people out there who are looking at ways of supporting you. So what are some ways that people can support you during this time?
I know we're working on ways to engage folks into some of the suggestions that you made just now, Rhiannon. One of the struggles that we have that has to be taken into great consideration is the confidentiality of survivors and victims, and also our own as an organization being sure that whoever we are working with is we want to ensure the safety of everybody involved. So what I recommend, anybody that's interested in connecting with us and volunteering beyond the crisis line, which we do have folks that are doing volunteer work, such as what you just described, but to email us at intake@bwss.org so that we can connect with you one-on-one and to find a way to tailor or connect you with the right possibility. And maybe you have ideas yourself that you're thinking of that we haven't thought of yet, or we've put on the back burner, and we'd like to bring those to the front burner because we think we're going to be in this for at least another 6 weeks or more. And as we continue to get the word out, and as victims begin to understand that there are resources and the calls that we're getting, we're going to need more of us involved in this. And so we would be happy to hear from you.
Great, thank you. And amplifying, there's people out there who are great writers, people who are happy to send letters. Who should we be directing them to in policy and funding decision-making tables that need to be stepping up and doing a better job? So who should we be directing them to be focusing on amplifying your voices to?
I would really recommend a couple of things. One is to send a note to if you're in British Columbia and any region, because every region has a version of this, to the provincial health officer. In the British Columbia, it's Dr. Bonnie Henry, who is amazing and has done amazing work, and to our premier, John Horgan, to ask them to make a statement about letting victims know that there are resources, and to connect with those resources, and that their safety matters, and the social isolation is compounding their isolation, and that we want victims to know that there are resources and that there's a way to get safe in this pandemic, and that needs to come from those leaders first and foremost. I would really appreciate those comments. And then the other one is to send a note to our federal minister, Marian Monsef of Wage, Women and Gender Equality, asking that they're able to find and release the levers to see the several $1 million that would go to all of those organizations that are on the front line right now, that are not shelters and are not sexual assault centers, which that those 600 organizations all across the land from coast to coast to coast really need that support right now. And they fall through the cracks of this federal policy. Those would be my two recommendations currently, and in terms of the provincial and federal government. And then finally, for the City of Vancouver, we want the City of Vancouver to recognize, of course, all of the issues around homelessness, but to understand that right now, women in the downtown east side Vancouver are experiencing profound violence on the street, and it's unprecedented, the levels of just horrific violence that is happening right now on the downtown east side for women. I've observed it myself. I've never seen anything like it, And it is beyond a crisis. It was already a crisis, and now we're in a whole another zone. And as all as our colleagues have had to make different changes and make choices around social distancing in terms of services, such as the Downtown Eastside Women's Center, who is our beloved colleague, we still need more spaces that are for women. So our beloved colleagues at Downtown Eastside Women's Center and Atira Women's Resource Society are scrambling to make that happen. And we really need their organizations and communities and the city of Vancouver to support women right now in the Downtown Eastside.
Thank you. So seeing that we've gone just a little bit over time. So just in closing, if we just, Angela or Summer Rose, if you just wanted to do just a quick wrap up of contact information, just to recap one more time where people can follow you on social media or contact you via email.
Should I talk again?
Sure.
So please do connect with us. The email is intake@bwss.org. The website, BWSS.org, is a one-stop shop for a lot of things, and we'd be happy to hear from you through our website. We're on Twitter at Ending Violence. That's all one word. And of course, Facebook, Battered Women Support Services, our page there. We really want to hear from you. We've got a lot of work to go and a lot of work to accomplish. We've just started. We've had some, I think the results that Summer Rain talked about, that for us, having an increase in calls is a good thing. And increases in texts and emails, this is a good thing. And we want to keep that up. And so we're happy to engage with our community, to connect and to collaborate and find ways to move what is, quite frankly, an unprecedented time of this kind of critical mass of understanding of women's experiences and relationships forward beyond COVID-19.
Thank you. So for those who are new to having these conversations, the reason why those phone calls are a good thing is because that means that people are reaching out for help. Doesn't mean that this is new abuse that people are enduring in their homes. It means that they're reaching out for help and support. So some homework for our lovely participants that I'm just making up and assigning now. Your homework is to have a conversation with at least 4 other people about things you heard and learned today, things that have inspired you, things that you want to talk about to push this forward and to keep turning the dial. So have the conversation. Homework item number 2, send money. Send money to Battered Women's Support Services and or your local neighborhood programs that are offering similar services. Homework item number 3 is to put pressure on all levels of government to step up and to bring this to the forefront and to talk about it on their platforms that they have. And to make sure that they are appropriately funding the supports that need to be put in place. And homework item number 4 is to please take care of yourself. Take care of yourself and take care of others. If we really live this world with one heart and one mind, if we are all not Samat, not Samat is one of our core cultural teachings. It's a Hunkaminam word and it means one heart and one mind. If we are all walking on this earth, not Samat, one heart, one mind, what a different place this would be. And we see that every day at 7 o'clock when people go out and cheer and support, when we come together in that one heart and one mind. But we can do it for more than 5 minutes a day. And we can do it with more, in more ways. And so those are my homework that I'm assigning to everybody. So thank you everybody for being here. Thank you to all of our amazing panelists. I'm really grateful for all of the work that you do every day. Your presence in this world makes it a better place, and the things that you do and who you are matter. And we don't hear that enough. So just really raise my hands in gratitude to all of you. And thank you everyone for bringing us into your homes and joining us in this conversation. So I think—
Thank you, Rhiannon.
Thank
you.
Thank you, and thank you everybody who attended took the time to attend a Zoom panel, which is new times, a strange way of being together, but still we are together, and thank you a lot for that.
Thank you, everyone. And thank you, Rihanna, for being awesome as usual.
Thanks.
Farewell.